Thanks a lot for inviting me to come and present the research and the teaching that we're doing here at Umeå University. As the introduction said, I'm an associate professor. I work with these issues, global health and climate change, every day. That's my research topic, and that's my teaching mainly on. So I guess I should start my presentation. Let's see if I can get it. I'm not very used with Microsoft stuff anymore. It's not up? Okay. So I work with global health and climate change. I work in the unit of epidemiology and global health. We have a long, strong tradition of collaborating with low and middle income countries. So a large part of the research we're doing is in collaboration with low and middle income countries. And that's where there is a lack of, a big lack of information on how climate change is affecting and is going to affect the health status of populations. So, so that's what we try to basically address with our research, both through educating people who could do research, providing research output, but also through teaching on climate change and health issues, research methods, policy into practice, etc. So my talk is going to be very quantitative in trying to bring up what we know today on health impacts from climate change, very overall, and then go into some specific details on how you could derive results and knowledge on this topic. It's very complicated. It's very challenging to research health impacts from climate change because it's extremely cross-disciplinary. You have to know a lot of things around climate change. You have to know health. You need to know the socio-economical influences on the global health status of populations as well. So this is a really complex research area, and it's not. It doesn't have a very long tradition to look at the nexus between climate and meteorology and health outcome either, and particularly the history of making projections and trying to understand the future burden of diseases. It's quite complicated. But I'll try to introduce you to this area. And if you're interested in more, there is more to learn from our research group, for example, and the teaching we're doing. You know, there's a lot of information globally online that you could also look at. Particularly the Ipcc report, FN's klimatpanels rapport, Intergovernmental Panel of Climate Change report. It was launched on the scientific basis, like the climate science basis was launched 2013, the latest one, the 5th assessment report, and on health impacts and society impacts. Another report was launched 2014, almost exactly a year ago actually. Those reports summarize both in the summary for policymakers the current knowledge on impacts, adaptation, mitigation to climate change, and also the climate trends. So if you want to update and read more, maybe that would be your first reading to read the summary for policymakers. Of course, there's much more to it. These reports are several thousand pages, so it's quite comprehensive and it covers a lot of issues. I mean, climate change affects almost everything in society in some way. So there's a lot of chapters on various perspectives in those reports. So I was part of the Ipcc as a chapter scientist. That's a sort of semi-junior role, helping the other authors with information and contributing to the process. I've also been involved in the work by the World Health Organization on trying to understand how climate change is impacting and will impact our health situation globally. And the research at the Department of Public Health and Clinical Medicine at Umeå University is very much involved in the very high level type of is a very high level player in this research area. Okay, so I'll discuss a bit. I guess most of you are familiar with climate change as a thing you read about in the media. Maybe some of you have even taken courses about climate change. I'm not an expert in climate science. I'm an expert in global health, interconnectivity to climate science, and the effects that climate has on our health status and population's health status around the world. And that's a bit of a different, but of course anyone who works in this area needs to know a little bit or quite a lot around climate information, because we use a lot of climate information when we do set up models and run projections, etc., on health burdens. Most of you probably are familiar with different scenarios of future development. We have the low emission scenarios where we go to a sustainable development and reduce our carbon emissions and greenhouse emissions. And then we have high emission scenarios, particularly an extreme one, which we call a fossil fuel intensive scenario, or business as usual type of scenario. And currently that's the pathway we're moving on. We haven't managed to change our emissions that much, so we're not currently moving on the low emission future pathway. Very important thinking about emissions that we make and that's going to affect us in the future in terms of climate impacts on health, for example, is that what we're doing today, if we would reduce our emissions today, there is still probably 40 or 50 years where the climate trend, the climate change would be about the same. The big change, if we manage to do something about the emissions today, is going to be seen around approximately 40, 50, 60 years from now. So, and that's also where the greatest future change are likely to occur. So both these scenarios that I show here, the RCPs, representative concentration pathways, 2.6 and 8.5, those are the very low and the very high scenario, and there's other scenarios in the middle. These climate scientists has generated depending on how much carbon greenhouse emissions there are in the atmosphere. And you could work, and researchers are working on these data, both finely resoluted data and larger scale type of modeling, to try to understand all types of impacts and adaptation needs in the society to this change. And that's what I work particularly much on. There's not one researcher that could respond to all different areas, impacts and adaptation in the society. Neither in the global health field there's not one expert that could respond to all health impacts, in very high detail. But it's divided into different groups that are experts on smaller parts of this. So it's a community that works together on climate change and health, and that's a community that shares and develops and try to provide the best evidence on what we know today on how this is affecting and how this will affect and how we could avoid impacts, and also provide projections on the extreme scenarios so to have a basis for policies to mitigate climate change. Okay. So the Ipcc, Intergovernmental Panel on Climate Change, was formed quite long ago. It was formed originally by the World Meteorological Organization and the UN Environmental Program. It's been doing currently up to 5 different assessments on the same topic, updating, including new research. The assessment from Ipcc are not research studies in its own. It's a synthesis of what's out there and how this could be used for researchers and for policymakers and for the public, of course, to understand more around this. So the work that I'm have been involved in is related to impacts, adaptation and vulnerability. It's the second working group of the Ipcc. The Ipcc has met several times over this assessment report period, took about 5 years. And there's a lot of meetings. There's an extensive peer review, which means that other researchers read and give critical comments to the content of the report. And then in the end, the final product is discussed with policymakers at an international level. Okay, so I'll jump directly to the final result of this report, and then I'm going to look into some details afterwards. But I think this is actually the very final report on impacts and adaptation from the Ipcc Human Health chapter and group. You can see 3 different scenarios on, or the first one to the upper left corner is actually the present picture on health burdens in relation to climate. And the red parts are the ones we could probably, if we have a well-functioning health system, if we have good infrastructure in the society, etc., we could prevent a lot of these impacts. And currently, almost all of the impacts that we see in different categories or different outcomes of health, undernutrition, infectious diseases, direct effects from heat waves, etc., food and waterborne diseases, almost all of these can be prevented, basically. When we move, if we look into the future climate and how we are going to be affected by climate change in the future impacts depend on the socioeconomic development as well, because as we become richer, or as we develop our health systems, or as our infrastructure in the society develops, we're going to be less susceptible to impacts from climate. We're going to build resilience to impacts. And but still, I mean, we can't really build resilience to all of the impacts if we look into the future, how we understand it now. Even in 2030 or so, we could see impacts from climate change, particularly in low and middle income countries where we can't build enough resilience. So we're going to see impacts that are basically irreversible, even if the societies develop. Okay, if we go to 2080 to 2100, like almost 80 years from now, so we're going to see much larger impacts. The health burdens from climate increase substantially, and the proportions of health burdens that we can't really prevent effectively are also going to increase quite much. But we're not there today. The last picture in the left bottom corner we could avoid through mitigation, through reducing our emissions, of course. And And that's something we need to show and explain to policymakers, so to make sure that we are going on the right track. Okay, so you see impacts are in vector-borne diseases, which mean mosquito-borne diseases, undernutrition mean stunting, etc. Occupational health impacts from heat exposure, for example, during harvest. From mental health outcomes. The mental health outcomes could be more research. There's a lot of issues here where we need more research. We need more evidence. But still, this is the picture of how the current knowledge. There's uncertainties, of course. Extreme weather events are going to affect us, of course. Heat waves, floods, droughts, a lot of different things. You read about them in the newspapers, not attributed to climate change, but to climate variability. And those are thought of as increasing in their intensity and frequency over time with climate change. Air quality is also something that's probably going to be affected, but in some of these areas, there's contradictions as well in the research. So when you put it all together, there might be it might look like a quite small health impact in some, because there's results going in both directions. We don't really know exactly how it's going to develop. But that's also a credibility, I think, in the way of presenting and communicating research. We should know what we are talking about, of course. So my question to you now is, how do we generate research, these results that you saw? How can you do research that show on future development pathways under climate change? It's pretty hard. It's a lot of complex methods, of course. But we do work on these issues on a daily basis. We work on vector-borne diseases, we work on heat waves, we work on other climatic extreme events, health systems. Maria works a lot on policy issues, building adaptation into the local governments and the health systems, basically. I'm going to show just a little concrete examples on how we do research on this. I couldn't give you all the picture because it would take me a couple of days or weeks or so, and I think you would probably fall asleep or something. Or get really hungry. But our team has about 20 people. We are very international in the way that we work with people from different countries, and we try to mix as much as possible, because there's no use of me doing all the research in a low middle income country, because it's quite unlikely that research will come to use in an effective way for that country. So there is a lot of students joining in as sandwich doctoral students in our team who are affiliated, who's working at an institution or a ministry of health in a country, and then want to learn how to do research that could be transferred to their own setting. And in that sense, they could join our team, and we could work together, and we could help them with methods to do this research. And in that way, the research is probably not going to be as much brain drain as it could be otherwise, where you drain these countries from knowledge. You try to give knowledge back to the countries in a way. So it's quite an interesting, promising model in that sense, I think. We work on vector-borne disease like dengue, malaria. We work on mental health outcomes in relation to meteorology and climate change. We work on occupational risks in very hot weather, for example. in sugar plants. We work on flight interconnectivity and the transport of diseases through flight networks and its connectivity or its interrelationship to climate, and the introduction of new epidemics in areas that are not having problems with certain diseases. You could, of course, transport some of them to new areas. And I'm going to give more specific examples on this type of research, trying to bridge a gap between interconnectivity, global flight networks, climate, and vector-borne diseases. Okay. Yeah, absolutely. Go on. So whether the question is whether there is a redundancy in the research, and that we provide evidence that's unique in some way, right? In the system of global players on this area. I think from my perspective, through having these international collaborations, of course, we try to complement each other, and we try not to invent the wheel once and twice and 3 times. And in the scientific system, you couldn't really do that much, because you wouldn't be able to publish something that's already known. On the other hand, I think it's also important that you could repeat some studies in a local context, because the local decision maker, the local stakeholders need also local evidence sometimes to act. So yes and no. Good to have questions. Was that okay? Cool. Yeah, it's a very good question. I think it's also a question I think that would be very relevant from a funder's perspective in terms of funding this type of research. You need to have a strategy on what type of research you're going to fund, and if it's already done, of course, you wouldn't want to fund it. Yeah, absolutely. Very good point. Okay, so I'm going to give a few examples before my time is out. I'm talking a bit too much, realize. This is one of the doctoral students. His name is Seve McQueen. He works in Kisumu at Lake Victoria in Kenya. Some of you might have met him. He's a doctoral student here. His research is basically trying to understand how climate change is going to affect malaria, which is the big health problem from where he's coming. And he's doing research at the moment, trying to develop prediction systems that could be used for adaptation, so adapting to climate variability in terms of understanding when the next big epidemic of malaria is going to hit his population. Malaria is affecting mainly under 5 mortality in his region, so children are affected, and it's a very fatal disease in that region. So to do that, Sevi has collected a lot of satellite data, because there's no weather stations in Kisumu where he's coming from. He's been analyzing satellite images to get data on the current meteorological situation, the current climate in his population. And he has also a big register on health, and malaria mortality in under 5 children. And then he started to analyze this. And the first stage is obviously to create relationships between meteorology, incorporating other important factors, and malaria mortality in this population. So he's been establishing a relationship between temperature and malaria mortality, and see that it's peaking around 28 degrees. He's established relationship between precipitation, it's the middle picture, and malaria. There is some delays between the events of meteorology and the disease occurrence, which is incorporated here. He can see that when there is a very heavy rainfall, when rainfall is increasing, there is increases in the incidence of the disease in his region. It's actually 3 different regions he's studying, and he see sort of coherent pictures between these regions. He's also looking at NDVI, which is a vegetation index, and looking into how the vegetation cover in different spatial grids, spatial areas, are contributing to the malaria mortality. And this is now developed into a prediction model, including other factors as well, in order to have something to understand when to act on certain under certain meteorological forecast or meteorological conditions. Okay, another project I wanted to mention, and it's going to be quite rapidly, I think, is the project that Ying and Mikkel, they're sitting here in the audience actually, there, are doing. Their projects are looking at the vectorial or the transmission of dengue in different meteorological and climatological conditions, including also other factors as well, and particularly the introduction of dengue to new areas. I don't know how much of you are updated on dengue, but it's Europe had a few outbreaks almost 100 years ago, and then because of the socioeconomic situation change, most likely, there hasn't been much dengue in Europe in almost 100 years, and now it's actually returning to the European borders again, as much as we know. And in 2010 was a big outbreak in Madeira. There's been also 2012, sorry. There's been also some transmission in France, Croatia, other areas of Europe. And their project is trying to understand how the risk of dengue outbreak is actually affected by flight networks, travelers going from different regions, carrying the virus, introducing the virus, vector establishment, meaning the mosquito prevalence or mosquito abundance, and the climatic condition in terms of the vectorial capacity, the reproduction rate of virus, and the ability, the potential of the mosquito to transmit effectively to humans in different regions of Europe. All this is actually important to understand the risk regions and the future consequences of under climate change scenarios. So dengue is a very complex disease. There is almost 1 million things that are should be taken into account when, or discussed at least, when you discuss dengue. And quite a lot of these things have been included in one way or another in these models. At an early stage, climate change health impact projections was pretty simple in a way. And now it's developing and trying to embrace a larger holistic perspective of the disease into making predictions. Okay, I think I need to jump a few slides. The lead time, when you do a prediction, you could also do a prediction as an early warning type of prediction, or you could do a projection. The projection we talk about when we do something under a climate change scenario. It's not actually prediction, because it's not likely to become a reality unless we actually move on the high emission or low emission scenarios. It's basically assuming a certain scenario of emission in the future. And then when we assume scenarios of emission, we could do projections up to 50 or 100 years or so, just like the climate scientists. There is uncertainties to these, of course. When we don't assume these scenarios, we could do modelings that are forecast or predictions of health burdens. That's quite useful in terms of increasing preparedness and preventing disease by making measures between a prediction till the onset of disease epidemics. So we could issue a lot of actions that are reducing the risk of the disease. In all these steps that we include, there is uncertainties. And these uncertainties are mostly quantified. There is still a need for a theoretical development on uncertainties and how we could handle uncertainties, both as disseminating as researchers like me, but also how policymakers should interpret these uncertainties and should consider uncertainties in their adaptation plans or mitigation plans. I'm almost running out of time. I'm going to drop a few pictures. Let's see. There's a lot of pictures. I could have stopped. I could have continued for a couple of hours more. Okay, so basically this map would be a quite nice representation on the synthesis of the work that we're doing. We're putting together these infectious disease models, mathematical models mostly, some statistical models too, on the biological system interacting with the human society. And by doing that and by looking at these models and developing these models, we could try to understand how the future would develop under climate change scenarios if we incorporate climate information in those models. And that's how the climate scientists are doing it, and that's how all the impact scientists are trying to provide a basis for decision making under uncertainty in the future. This is the relative vectorial capacity of dengue globally as the current period, 1980 to 2009, and in the future under the high emission scenarios. We've also made projections under less fossil intensive scenarios, of course, to have something to contrast with in terms of future development. What you can see is a large change of the vectorial capacity suitability from tropical areas where it's actually could be reduced to some extent in the future if we have a rapid and quite extreme climatic change, to European regions where it's going to become much more suitable for the vectors to proliferate and transmit diseases. I think I need to stop here actually because I talk so much. Yeah. I mean, generally, it's the ones that are, I think, largest are either cases of events that occur and that are discussed in terms of climate change, like, you know, the epidemic of dengue in Madeira, where it hasn't occurred before. Of course, it's discussed in terms of climate. So a lot of these things that are floodings, etc., in Jakarta or in these regions are discussed in terms of climate. And I think the message there is it's still quite clean. What I think is getting most attention where it shouldn't be so much attention is whenever you ask a researcher in the media about, you know, the impacts or the knowledge, evidence status, the media always also ask a skeptic, climate skeptic, and they get almost the same room. But if you go to the research community, there might be 5 skeptic out of 100 or something. So it's not in that way a balanced picture from the scientific community. I think that's a bit misleading. And I think a few people who's had personal reasons or other reasons, I don't know what reasons, to be really skeptic have also changed the debate a lot, to be on the wrong side, you know, to be on uncertainties instead of certainties. You know, there's always some certainty, there's always some uncertainty, but you could focus on both or one of them, and if you want to, you could of course only focus on uncertainties. I think that's all I wanted to or have time to say.